Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former CMP examiner. Today, I want to come on and discuss gout and how it can be related to hypertension. So, we've done videos on gout in the past. I hope you guys found them helpful. If you haven't seen them, just go check them out, just about gout in general and VA disability. So, today, specifically, one of the more common connections that I see for gout are related to hypertension and diuretics that are used for the treatment of hypertension. Okay, so let's first start off by talking about what gout is. So, gout is a type of inflammatory arthritis that can um, be caused by a variety of things, right? So it's caused by a condition called hyperuricemia. So hyperuricemia is when you have too much uric acid built up in the body, and it's either because you're ingesting or taking in excessive amounts of uric acid containing products, or your body just isn't able to excrete them through the urine as well as it should be. So there's some kind of dysfunction, whether it's you have kidney disease or something like that. You're either building up too much uric acid or you're not able to get it out of your system quickly enough so it builds up. Okay. And so what happens is that uric acid buildup can wind up creating deposition of uric acid particles in different parts of your body. A lot of people will have it in their joints. It presents a lot of time in the big toe. That's often called podagra. And it can be extremely painful. Okay. It can be quite often, or you can have flares. Let's say if you're ingesting too much, ingesting too much red meat, or you're drinking a lot of alcohol, or some things that contain a lot of uric acid. When you know what your triggers are, if you ingest too much of it, it can cause it to become more frequent. All right. So that's a basic breakdown of what it is. So some of those risk factors, again, just being male in general, sorry guys, being obese, having certain health conditions like congestive heart failure, hypertension, like I mentioned, insulin resistance, metabolic syndrome, diabetes, poor kidney function, like I talked about. This is from the CDC. I'm reading off some of these, the Center for Disease Control. I'm reading off some of these risk factors. Using certain medications such as diuretics, I think I already mentioned that. Drinking alcohol, the more you drink, the more your risk goes up for having these events or having gout. Eating food or drinking drinks that are high in fructose, which is a type of sugar. A diet high in purines, which the body breaks down into uric acid. Some of those types of foods are red meat, organ meat, some kinds of seafood like anchovies, sardines, mussels, scallops, trout, and tuna. Okay, so usually it's treated, it can often be treated by a rheumatologist. Primary care managers can also treat this. Sometimes people are put on medications to help prevent it, to decrease your uric acid. Sometimes that's not necessary and you just take medications when you're having those flares. It just depends on the specifics of your condition. Okay, so how can a veteran be service connected for gout? So there's several ways, right? So I'm not going to jump into a ton of them because I want to be specific on the hypertension piece. But if you were diagnosed with gout in service and you've continued to have it since service, you can be connected on a primary or direct basis, depending on, how long it's been, if it's, if you've had continuity of the condition over the years, et cetera. On a secondary basis, again, things that cause obesity, if you've got a service connected condition that causes obesity, if you've got, you know, a mental health condition with alcohol use disorder, okay, you always have to look at all the risk factors and weigh them against one another to see what is the more likely cause, or at least as likely as not, does this condition cause this condition or aggravate it or worsen it, etc. So when it comes to hypertension, again, hypertension and especially the use of diuretics can become problematic. All right, so I'm going to pull up some of the literature that I like to use in some of my articles. That way you guys can talk to them with your healthcare provider if you believe that this may be related to your service-connected hypertension, if you've got service-connected hypertension. Okay, so incidence and risk factors for gout in white men and this doesn't have to just be for white men, right? It can be extrapolated to other, demographics, right? Other races, women, whatever. Incidence and risk factors for gout in white men, conducted by John Hopkins and published in the Journal Journal of American Medical Association supports that hypertension is an independent risk factor for the development of gout. Based on the multivariate Cox proportional hazards model, the relative risk for hypertension in the development of gout was 3.26 with a 95% confidence interval. Treating hypertension may decrease the morbidity and mortality of gout. Okay, another article published in Arthritis and Rheumatology studied a cohort variable with hypertension examining risk factors. Again, it was found to be an independent risk factor. Another article titled Obesity, Hypertension, and Diuretic Use as Risk Factors for Incident Gout, a Systemic Review and Meta-Analysis of Cohort Studies, published in 2018 in Arthritis Research and Therapy. It's a good article. And I will drop one more for you guys to go and take a look at. It was published in the British Medical Journal titled Antihypertensive Drugs and Risk of Incident Gout Among Patients with Hypertension, a Population-Based Case Control Study from 2012. So that's a whole mouthful. Again, I have some different sections that I pull out and utilize when I'm writing a letter in support of this type of nexus or condition. But I don't want to bog this down by reading research articles. You guys can go pull those up and take a look at them and hand them over to your healthcare provider, and they should be able to, have a frank discussion with you about if this may be really, if you're suffering from gout and if it may be related. Okay. I hope this was helpful. Please drop some comments if you guys have any questions. Check out that other gout video. I'm probably going to do another gout video specifically related to PTSD and alcohol use disorder coming up in the next few months. So thank you for watching, and I'll holler at you guys soon.